And it is those equations that we'll finish our general principles of pharmacokinetics with. You have a number of equations that are shown to you in your syllabus and on the screen. First, equations that deal with single dose of drugs. Most of those, you already know them. You remember that we can calculate volumes of distribution based on dose administered and based on the concentration at time zero, which is extrapolated from graphic analysis on the computer. And the key point here were how dose and concentration were directly related versus volume of distribution, and concentrations were inversely related. You remember further that a half-life is inversely related to the elimination parameter k by a factor of 0.7, and in turn k is directly proportional to clearance by the parameter volume of distribution, clearance being a volume of blood eliminated of drug per unit of time. From there, we showed ourselves actually how we could derive the fact that then half-life and clearance were inversely related, and by combining equations 2 and 3, we came up with the fact that either clearance was volume of distribution times 0.7 over T1 half, or rephrased here, the half-life is 0.7 times Vd divided by clearance. So I'll take for granted you understand these equations. Our big work then remains with the following equations, 3 important equations that are used in the situation where drugs are given chronically, multiple dosing, essentially equations that will involve steady state concentrations rather than C0s. Well, those 3 equations are based on some classic pharmacokinetic concepts. Their relevance on your exam is again to know the relationship with parameters much more than knowing how to calculate and plug in numbers in there. In order to understand these equations well, let's follow on the whiteboard how we can conceptually understand the steady state. I think it will help you to know these equations better. Imagine this is your body, just like a bathtub or a sink. You bring drug in, the top arrow, it gets into your body, but at the same time as it gets in your body clears it, brings it out. The classic example, in high school, a bathtub, you open the faucet, but stupidly the plug is open. Then obviously, you know that there would be a certain flow rate of water in your bathtub that would manage to match the flow rate that leaves the bathtub, so that water would remain constant in that bathtub. This is exactly what we're going to do with our drugs. We're going to try and match the rate in with the rate out. And when rate in matches the rate out, we should achieve a steady state, which is often measured with a steady state concentration labeled CSS here on the diagram and in your syllabus. Now, what is a rate? A rate is generally an amount per unit of time, and rate in would be the amount per time. In other words, how much drug and how often you give that drug to the patient. The rate out, well, it could be also an amount per time, but we've been using a much more relevant parameter to measure how well the body clears the actual drug. And that was the parameter of clearance. And clearance is our parameter for rate out. Clearance, however, is not given in amount per time. What is clearance given in? Volume per time. If that's the case, I'm sure you can come up for me with what should be the general equation relating a concentration at steady state with those parameters of rate in and rate out. Just remember, what are the units of concentrations? Units of concentrations are amount per volume. Look at rate in, amount per time, rate out, volume per time. What should you do between the 2 parameters, rate in and rate out, to end up with a parameter given in amount per volume? Hopefully it jumped to your eyes, and hopefully you didn't have a black eye out of it, otherwise I'm sorry. You see that it's rate in divided by rate out. If you divide rate in by rate out, amount per time divided by volume per time, you end up with a parameter in amount per volume, which is a parameter of concentration. Our only problem then in life right now is to figure out how do I call rate out Well, I call it clearance. And how do I call rating? That's where we're going to have two different ways of bringing drugs into the body. But overall, the classic equation is that CSS is rate in divided by clearance. Now, having said this, there are two ways of bringing the drug in. One of the first way that is shown in your syllabus is to bring the drug in as an infusion. And when you give an IV infusion, it has a name. It's called K0, the rate in. K0, that should remind you a constant, and zero order kinetic. Now that's funny, we talked about zero order kinetic for elimination earlier on. Here we're talking zero order kinetic of administration. Indeed, an infusion rate IV is a constant amount of drug per unit of time, by definition a zero order rate, but here a zero order rate of administration. Whatever the case may be, from this first point stems your first equation telling you that CSS for IV infusion rate is K0 divided by clearance. So now let's look at the computer screen and let's look at the very first equation. The very first equation dealing with infusion rate K0 tells you that if you wanted to calculate the infusion rate to achieve steady state, it would be equal to clearance of that drug times steady state concentration. Let's go back to the whiteboard. If CSS equals K0 divided by clearance, there is no doubt that K0 equals CSS times clearance. Classic point, as always, whatever you give the patient, the amount is directly related to the concentration you obtain in the body, and there is an inverse relationship between concentrations and clearance. The faster the clearance, the less the concentration. The slower the clearance, the higher the concentrations, allowing us to, of course, adjust K0 based on clearance as a parameter in that patient and based on whatever steady state concentration we're trying to achieve for the therapeutic efficacy of our treatment. Second possibility, and we're still going to use the whiteboard. All I've done is simply wipe out the issue with K0. But you know that another possibility, rather than an infusion IV, is the classical administration of maintenance doses, which we're going to call MD. And those maintenance doses, MD, are going to be given every so often. Every so often is what we call the dosing interval, tau. For instance, if you decide to give a drug 3 times a day, in effect, what you're doing is giving a discrete dose every 8 hours, 3 times a day. Vice versa, if you want to give a drug every day, only once, like a statin every evening, as we talked about earlier on, then your dosing interval would be 1 day. If you divide the amount of drug you give by the dosing interval, you get a rate, the rate in, which is an amount per time. So try and phrase for me the actual equation that would relate our steady state concentration when a drug is given as a maintenance dose every so often. I hope you're thinking CSS is rate in divided by rate out. My rate in right now is MD divided by tau, a maintenance dose every so often. My rate out is always a clearance. This is equation 3 in your book on the computer. Of course, what is important for us right now, we know what concentration we'd love to achieve. Hopefully we have an idea of the clearance in that patient. We know how often we want to give the drug. The question is generally, what is the maintenance dose? Can we pull out the maintenance dose from this equation? I hope you can still do this kind of mathematics, but let's try it in 2 steps. You could write that MD divided by tau is CSS times clearance. And from there, you get rid of the tau and bring it to the other side in order to have the final equation that you have in the syllabus, which is a maintenance dose, is the steady state concentration you try to achieve times the clearance of that drug times the dosing interval that you've chosen. And this is another important relationship, allowing that calculation of maintenance doses, showing us once again how doses and concentration are directly proportional, or if you want, how there would be also inversely related with clearance if you were moving that parameter on the other side. We left with one critical point, which is the equation number 2 in that page of the syllabus, which is to remember the other concept we've pulled out right from the beginning. You know that a concentration, we said, is an amount per volume. And if that's the case, I should have yet another way of writing a steady state concentration. Certainly it's rate in divided by rate out. We've established this. But as an amount per volume, a CSS really should be a certain amount of drug into the volume it goes into, which is volume of distribution. The question is, what should I call the amount of drug which, if it were given all at once, would result in a concentration equivalent to that of steady state? Well, maybe some of you are starting to think, wow, this is the loading dose. Since the loading dose was a one-time dose given to immediately reach effective concentrations. And if those effective concentrations were those of steady states, then that's when we use that loading dose. Sure enough, by definition, if concentrations are amount per volume, we can rephrase this with pharmacokinetic parameters as CSS equals loading dose divided by volume of distribution. And thanks to this, there is no doubt that now you can calculate a loading dose irrespective of whether you want to give that drug every half-life or whether or not the CSS you're trying to achieve is the minimum effective concentration. Indeed, to replace loading dose, to calculate the loading dose, all you would have to do is CSS that you want to achieve times the volume of distribution of that drug. This is the equation that is given in your syllabus as equation number 2. Loading dose is VD times CSS. Well, I hope this will have explained those equations. After all, it is more important to understand where those parameters come from so that you can play with an increase or decrease of a parameter and what it does to others, much more than calculation. Let me tell you that at the end of each chapter in your pharmacology syllabus, you have a number of questions to work on, generally about 20 to 30 questions, so that like this you get a workout of the small section we've covered. And importantly, you will find that in the general principles, purposefully, we've given you a number of problems using those equations and forcing you to do calculations. I would not like you to come out of this thinking, oh my goodness, calculations are very, very important to do on the exam. Rather, the idea of us giving you a number of questions with calculus in it is to force you to use the equations and become familiar with those equations. But don't be surprised if on the exam, rather than requiring you to do calculations, they require you to reason the equations, such as we've done several times over the past 3-4 hours. For instance, cutting an elimination by 1/2, what would it do to the half-life? What would it do to the time to reach steady state? You realize that if you've understood those relationships, you really don't need to calculate much. You just need to work out the relationship between those parameters. This closes the pharmacokinetic section of the general principles. We'll follow this with pharmacodynamics, or the effect of drugs that comes from drug receptor binding.